Good afternoon. Thank you all for joining today. Our agenda will begin with County Executive David Crowley. Next, we'll hear from Mayor Tom Barrett. We're also joined by Dr. Ben Weston, Director of Medical Services of the Office of Emergency Management, and Dr. Jeanette Kowalik, Commissioner of the City of Milwaukee Health Department. Thank you all for being here, and I'll hand it over to County Executive Crowley.
Thank you, Catherine. Good afternoon. Thank you for joining us. As everybody is aware, Milwaukee County and the nation, we're facing two public health emergencies right now. One acute emergency caused by COVID-19, and one that's been deeply rooted, which is caused by racism. And here in Milwaukee County, we are committed to battling both. And in our efforts to examine our own policies and procedures through a racial equity lens, I'm pleased to announce that this Friday, June 19th, will be a floating holiday for Milwaukee County employees in order to honor Juneteenth. This is one of our oldest nationally celebrated commemorations of the end of enslaved Black people here in the United States. And given our commitment to achieving racial equity and becoming the healthiest county in Wisconsin, we must recognize this important day in American history. And it is my hope that county employees can celebrate this rich history and culture of African American community, which is a day to also appreciate the long struggle for civil rights that Black people in America have faced for many centuries. And many of you may be aware as well, just a few hours ago, a coalition of county, city, and local community partners recently launched the We Care Crew, which is going to be focused on providing resources to communities of color that have been impacted by not only COVID-19, but also racism. And together, this group will be committed to engaging communities in public health education and providing resources utilizing Milwaukee County parks as a temporary distribution site. And so these efforts will be focused at the following parks: McGovern, Moody, Sherman Park, Smith, Tiffin Tyler, and Washington parks, in addition to our community health centers, King and Kazi. And we may be adding more parks to the future. And the point of the We Care Crew is really to distribute face masks, meals, resource bags, education on public health, and provide access to certified credible messengers. All efforts will be incorporated in physical distancing, and participants will be provided with safe masks, because we know that this summer we need to provide safe and healthy recreational alternatives. And this is going to be key. And I just want to make sure that I say thank you to the Green Bay Packers for their $20,000 donation, which will be used to provide 2,500 resource bags to the community. And in these bags, there will be PPE, public health information, healthy snacks, and books for kids. When we're talking about the parks, I also want to talk about two particular events that we have coming up. These are community bike drives that are going to be happening at both McGovern Park and Lincoln Park this Saturday, June 20th, from 9 a.m. to 5 p.m. So we're asking people in the community, if you have gently used bikes that could be donated, we will be accepting those bikes in the morning at both locations, and we will be distributing those gently used bikes to the community as well. And if you would like more information about that, you can definitely visit wecaremke.com. Also want to talk about Milwaukee County Zoo. This past weekend, we had an outdoor experience with limited capacity. And it was great to see so many people that was able to come out and participate and enjoy our zoo. And I also want to say thank you to those families for respecting the physical distancing requirements and following the guidelines posted throughout the zoo. It's really important that people understand that we want people to have fun this summer. But the only way to do that is to continue to practice physical distancing, wearing your mask. We want folks to know that the Milwaukee County Zoo is a perfect place to do that. And also remind folks that we recently announced $10 million of the CARES Act funding to provide some housing acquisition, eviction, prevention, and mortgage assistance to folks who are facing housing and financial instability. And so if folks are looking for programs that they can call and get some assistance to, please call Community Advocates Rental Housing Resource Center. The number there is 270-4646, or you can visit communityadvocates.net. And we highly encourage you to reach out and go after these resources right now, because they will go fast. We know that the amount of money that we put towards this particular initiative would only scratch the surface. And so please make sure that you're encouraging folks to apply if they need it. And then lastly, I want to talk about the importance of getting tested. We have seen a dramatic drop off in the number of people getting tested at the 2 National Guard sites at UEOC and Custer Stadium. And so we know that people are out protesting, enjoying the nice weather with their family and friends, are probably going back to work. But I want to remind folks that all of these types of gatherings lead to an increase of exposure and the potential to heighten the community spread for the community spread of this virus. And so it is important to understand that we have to do our due diligence. We're seeing across the country an increase in alarming rates. And we are not done with this virus, and we need to be cautious. So please continue to practice physical distancing, wear a mask whenever you can. This is extremely important because we have to continue to protect ourselves and our loved ones. So if you are feeling symptomatic, if you're not feeling well, do not wait to call your doctor to get tested. Call them right away, call your provider. And if you don't have a provider, please call 211 in order to find a testing site near you. So that's all that I have right at this time. So I will hand it over to Mayor Baird.
Thank you very much, County Executive Crowley, and thank you all for joining us today. The City of Milwaukee, along with Milwaukee County, actually we've had the practice in place for some time now, also has a floating holiday for Juneteenth Day. And so we're pleased that the county is joining us this year for its employees. And I think we all recognize that given all of the racial turmoil and the cries for justice that we're seeing throughout the country at this time, that this Juneteenth Day will be a special day in our country. I raise that not only because of its significance, both its historic significance and its contemporary significance, but I raise that because it is also occurring, as we all well know, during the midst of this pandemic. And I anticipate that we will see a lot of people on the streets of the city of Milwaukee on Friday. I want to encourage, as I have many times before, I want to encourage individuals who are exercising their First Amendment rights and are fighting for justice, that they should also be mindful of the healthcare challenges that they might be creating for themselves and others. And for that reason, again, to the extent that I know it's a tough ask when there's hundreds, if not thousands of people around to maintain social distance. But as I said repeatedly, there are no exemptions that have been created for this pandemic. And so I am concerned. I am concerned about individuals contracting and spreading the disease in any large setting of people. So again, please maintain your social distance. Please wear a mask. And if you're feeling any symptoms whatsoever, please make sure that you take advantage of our many testing sites that we have throughout the city and the county, which is a segue to the testing sites that we have, the community testing sites that have been administered by the National Guard now for some time. Just an update on these numbers. UMOS has tested last week 636 individuals, Custer 254, for a weekly total of 890. Now that obviously is down significantly from what we have been seeing in prior weeks. The combined total is now 31,514. The National Guard, which has been very helpful in this regard, will continue to collect specimens. They will not, however, be operating July 2nd through the 5th in order to allow members to observe the holiday weekend with their families. But both National Guard testing sites will operate through Wednesday, July 1st, and then will return again on Monday, July 6th. Another very, very important action that the city has taken, and the city council this morning took significant action, deals with our Active Streets for Businesses program. As Commissioner Kwok will explain, we remain in phase 3 of our Road to Recovery for the city of Milwaukee, which means that restaurants can have people basically 25% of their capacity. In order to give businesses an opportunity to safely expand their opportunities, we've created this no fee pilot program, allowing restaurants and bars to apply to expand their seating accommodations by using sidewalks, parking lanes, and travel lanes for outdoor dining while adhering to proper physical distancing. As I said, the program is free and to apply, and it's not limited to any specific portion of the city of Milwaukee. Any restaurant or bar citywide can apply for this program. There are some speed limitations, probably are the ones that are going to be most telling. That's primarily for businesses that are located on streets that have speed limits of 25 miles an hour or less. So if you're on a busy street, it's not conducive to having people in the street or on the sidewalk many times. But the program follows the Milwaukee Health Department's guidelines in moving Milwaukee forward. The application will go live tomorrow morning, June 17th, at milwaukee.gov/DPW. The webpage will have guidelines for the program and clear step-by-step instructions with a link to apply for the permit via the City of Milwaukee's land management system software. The proposed dining area must, not surprisingly, comply with health requirements intended to slow or prevent the transmission of COVID-19. Tables and chairs must be removable and must not restrict the pedestrian flow in and out of a building. And of course, they must comply with all state and local ADA guidelines, including access ramps and furniture selection. DPW, the license office, will be reviewing this, and the turnaround will depend on how many applications are received initially, but we're hoping that we'll have a very, very quick turnaround on this. We're seeing this in a number of cities. We think that this is really a great, great tool for businesses throughout the city of Milwaukee. So we work very closely with the city attorney's office, the city clerk, the Milwaukee Police and Health Department to ensure that this program is safe. So I'm pleased the Common Council adopted it this morning. And again, we'll be ready for business tomorrow and for people to start applying for it. So again, this is something you might want to keep in mind as well. So with that, I'm going to turn it, I think, over to Dr. Weston, if I'm not mistaken, to give us the latest information. Thank you very much.
Thank you, Mr. Mayor. Good afternoon. As always, first to our numbers, we have 9,678 cases of COVID-19 in our community and 322 individuals who've died. We also have a new map tab on our dashboard that is public facing, and this shows testing information by census tract. So this includes testing rates and percent positive as broken down by geography to get a better understanding of the layout of our community. I want to talk today. I see and I hear and I receive comments that people are confused and fatigued with the messaging on COVID-19. I think anyone would be forgiven for not knowing how to stay safe, how extreme to be with physical distancing, and what practices to follow. I think depending on what channel you watch, what newspaper you read, or what neighborhood you live in, you may hear different opinions and receive different pieces of advice. A simple fact is that COVID-19 is still with us. Though we are seeing promising trends in hospitalizations and especially in certain parts of our community, percent positive case counts, the virus is certainly not gone and will likely increase at some point in the future, as we are seeing in most states throughout the country. So everyone will take different steps to stay safe, but I think there's 3 key items that you can consider when determining what activities to do and what perhaps not to do. So 3 items. 1 is people, 2 is space, and 3 is time. So people means how many people do you interact closely with? The people you live with are fine. You can interact with them as much as you want. Outside of that, try to interact closely with only a small, trusted few at this time. So with each person you interact closely with, keep in mind that you're also indirectly contacting everyone else that they interact with as well. So keep your circle as small as possible, ideally not much larger than those with whom you live. Next is space. So space means how you interact with people, aside from those in your closest circle. So you can get together with family, you can get together with friends, but try to do so from a distance. And being outdoors in open air also adds a substantial added element of protection. So you can interact with your friends and your family, but do so in an open air environment outdoors and try to keep 6 feet of distance from each other. You can set up tables and chairs further apart. And also, while not a substitution for space, wearing a mask in public can further decrease transmission of disease. So 3rd is time. Time means how long you interact with someone. So while passing someone for a split second while walking on a path in the park is very low risk, sitting next to someone for a half hour in a restaurant is quite high risk. So keeping these 3 key elements, again, people, space, and time, in mind at all times is critical regardless of symptoms. We know also for a fact, a well-studied fact, that COVID-19 is contagious and can be spread when you have the virus in your system but don't yet have symptoms. So that means we have to limit the number of people, maintain space, and minimize time always, regardless of symptoms. So as you return to a more normal way of life, remember people, space, and time. Be with those who you enjoy spending time with, but be creative in ways to maximize safety by decreasing the number of people, increasing the space, and minimizing the time. Lastly, I want to return for just a moment on the numbers I mentioned at the beginning. 322 individuals who have died. As I read them off each briefing, I think it's easy to start seeing them as an aggregate statistic, a percentage of the whole. However, as I stated in the beginning, there are 322 individuals who have died. These are parents, their husbands, wives, best friends, co-workers, sons, and daughters. And if you haven't yet been touched by loss during the pandemic, I think you're probably one of the lucky ones. This last week, I personally saw 2 close friends affected, one by the loss of a father and another by the loss of a brother. The pandemic is real and the effects are widespread. Despite differences of opinion or outlook you may have with those you live with or those you love, understand that this is a challenging time for everyone. We can't know the struggles that others face or the impact this pandemic has on them. So please be kind to those around you. Thank you and stay safe. And I will hand it off to Commissioner Kowalik.
Thanks, Dr. Weston. Good afternoon, everyone. So kind of echoing the points that Dr. Weston made about people, space, and time as far as our call to action to prevent the spread of COVID-19, considering now that it's warmer outside. We've been waiting for some glimmer of hope related to improvement of weather here in our area. But I just wanted to talk about a couple of items related to our COVID response. And one of them is related to, as the mayor noted, our phase 3 order in the city of Milwaukee. We're aware of our suburban partners that have moved into phase C, as in cat, but we're still in phase 3 in the city of Milwaukee. And that means that the occupancy is still 25%. That includes indoor and outdoor. I have seen some places that were not social distancing or making adjustments, so we will be following up with those groups. The concern, again, is movement versus being stagnant, being indoors versus outdoor, people wearing masks or covering their nose and mouth, and then, again, the time that's spent being close to another person less than 6 feet. So we wanted to just reiterate the importance of these things. As we know, people are exercising their freedom of speech and the ability to assemble and demonstrate, that there still needs to be a mindfulness about preventing the spread of COVID by taking some personal responsibility of wearing a mask or face covering. And I just wanted to again show, because I've seen this too, of, and I don't have my mask, but I have a bandana here. So it has to cover your nose. This, what's the point of wearing it? It's like not doing its full, or it's not being used properly, so you're only getting half of the protection. You're still breathing through your nose. So you need the cloth to filter the viral matter from getting in, leaving you, and then getting out. So again, make sure that's covering your nose and going down to your chin. It's extremely important, if you're going to wear a mask, to wear it the proper way to have the full benefit. We know that there's a lot of opportunities, including Mask Up MKE or Milwaukee, that are out there that are promoting and providing people in our community with free masks. So there's a lot of opportunities to get masks if you don't have them. There's a number of outreach strategies, especially as Juneteenth is underway, that will be able to provide access to masks and mouth coverings for our community. We also want to remind people about hygiene, hand washing, using sanitizer, alcohol content of 60% or greater, especially if you're out and about. I know that sanitizer is more accessible than it was early on in our COVID response. So you should be able to pick some up from your drugstore or grocery store or other outlet. The price shouldn't be astronomical. If it is, you can report price gouging to DATCAP, which is the state's Department of Agriculture, Trade, and Consumer Protection. There shouldn't be any like $15 markup on a 2-ounce bottle of hand sanitizer. So again, you can report those things. Also, I wanted to talk about youth. We used to have a saying when I was the health director for the Boys and Girls Clubs of Greater Milwaukee of FTK, for the kids. So we would do everything with a spirit of upholding youth and investing in our future. So with that being said, we want to share some updates about COVID-19 and the impact on youth. And I know a lot of our focus has been older individuals, adults, if you will, people with underlying health conditions such as myself. But we are seeing that there is an increase of cases among youth, so individuals under the age of 15, mainly in the area of the South Side, so 53215 and 53204, where we're seeing an increase. So we want to just put the word out that just because you're not older or because you don't have a health condition doesn't mean you can't be negatively impacted or infected by COVID-19. Yes, you may recover from it, but you don't know what damage may be done long-term. You may have some disability associated with being infected by COVID-19. So if you can reduce or prevent from being exposed to it, I would definitely support that and think that that's the wise choice instead of taking a risk and getting infected and not knowing what that's going to do to you. Also knowing that you could be a carrier of the virus and infecting other people that may have more challenges with their immune system and being able to fight off COVID-19 infection. So again, don't think about yourself, think about other people, at least one other person. That's what I've been telling a lot of younger people as we're moving through this pandemic response. And again, as Dr. Weston noted, that we're seeing an increase, and now that the Latinx population is the majority of cases in our area, that we're seeing it's about 40% of all cases in the city of Milwaukee. So we definitely put the call to action out of as far as resources and partnerships related to our Latinx population, and stressing that we're here to help, and whatever resources we can provide, we definitely would like to continue to learn about what is needed to help people in our community. And some of the feedback we've received so far is related to economic relief and support of families not being able to take the time off or be able to make ends meet because they are sick. So again, having access to resources is very important. And we know this impacts many others in our community as well. But just, getting that feedback, what can we do aside from making sure that outreach materials are available in Spanish and they're culturally appropriate. There's a number of community-based organizations that are out and doing the work, handing out masks, educating our community. So we just want to continue to uplift and support that work. And then lastly, I just again want to highlight the employers that have been working on getting things up and going and have been very cooperative. I know that El Rey grocery store, which is located where we're seeing the highest incidence of COVID-19 in the city of Milwaukee, had voluntarily closed. We were in conversation with them, and we just want to highlight and thank them for being proactive and working with us to prevent the spread of COVID-19 in our community. So, and that's what we need. We need partnership. We need to be able to work together and really help small businesses and the community get up and going. So again, we don't want this to be like a punitive approach or a dictator type of thing. We want to work together because this is about suppressing and eliminating the spread of COVID-19 so we can move into this new normal that we're preparing for down the road. So thank you.
Thank you. We do have several questions coming in from reporters. The first two are about active streets. Rich Revita from Milwaukee Magazine asks the mayor, do you plan on shutting down any city streets to accommodate the Active Streets business program?
Well, again, the criteria is set forth in the legislation that was just passed, and I don't necessitate closing down any streets, but it will use parking spots. It'll use the public right of way, primarily in those areas where the speed limit is 25 miles an hour less. It is a pilot program. It'll end November 15th. So all uses within the public right of way will need to be removed by then. We've already seen interest from businesses on Donner Avenue, on Old World 3rd Street, on Broadway Avenue in the 3rd Ward, KK, North Avenue, and Brady Street. So we know that there's a lot of interest in the program. So again, I think we'll all learn together. We're in uncharted waters, but we want to be responsive. We want people to be safe and healthy, and we want our businesses to be able to get back as close to normal as they can.
Mayor Baird, I think you just asked or answered Hannah Hilliard with WISN's question. I don't know if you have anything else to add, but she asks, are there any specific businesses or areas already showing interest in the Active Street program?
Well, as I mentioned, Donner Avenue, Old World 3rd Street, Broadway Avenue, KK, North Avenue, Brady Street. All businesses along those areas have all shown interest. And I anticipate even more will show throughout the city of Milwaukee. And we want this to be something that businesses throughout the city of Milwaukee benefit from.
Perfect, thank you. Mark Stevens with CBS 58 asks a question for Mayor Barrett and Commissioner Kowalik. He asks, now that retail businesses have been reopening with COVID-19 guidelines, do you believe those changes are restoring people's faith in venturing back out in public to these stores?
Commissioner, I'll let you jump in on that one.
Yes, I mean, I definitely know that there's been some easing, and then of course pivoting on this anti-racism, anti-Black racism movement and the police violence in our country right now. So there's a lot of attention on that. So the media, the COVID media has been shifting a little bit. I know that impacts practice and what people focus on. Again, why we're having this today is just to reiterate that COVID-19 is still a threat, it's still in our community, and we still need to be mindful that we have to take precautions to prevent the spread of COVID-19. So that's one. Two, I think a number of businesses that have been sharing what they're doing to prevent the spread of COVID-19. They're talking about their cleaning practices, they're talking about their staffing, they're talking about how they've adjusted spacing and things like that. I think that's helping relieve some of the concern from the public that businesses are mindful about how they're reopening, and that's why we've been receiving, a number of requests for information, these webinars that we're rolling out that are specific to sectors, partnering with Medical College of Wisconsin and MMAC and other groups to make sure that there's guidance related to how do you reopen. We talked about powering down and closing, but how do you ease into reopening and do so in a way that's safe? So that's really important for us to share that information, that we are reviewing plans. Like a lot of the larger businesses per se have been sending their plans to the health department for review. So we have been working on that.
All right, thank you. Matt Smith with WISN would like to ask his question of our guests.
Hi, Mayor. Hey, and for the Health Commissioner as well, as we look ahead to the election in November, I know that's a ways away, but I guess not really when we're planning. In terms of the council today, Mayor, and the Election Commission, it seemed like there was some concern over how the commission is prepared or will be prepared to handle the election. How confident are you that we're not going to see a repeat of April come November?
Well, I think all of us recognize that April was a fiasco. And for weeks before the election, I was telling the governor and the legislative leaders that it was going to be very problematic, that having an election in the height of a pandemic was not a smart thing to do. The fact that you had conflicting guidance from all sorts of state agencies, the fact that the Wisconsin Supreme Court and the United States Supreme Court within approximately a 5-hour period, both issued decisions changing the ground rules for the election, just tells you what a tumultuous period that is. I think we get back to our normal lives and forget, wow, that was just crazy. But it was crazy. And I feel very confident. I've been working closely to develop a plan that will make sure that we have very safe voting and that people will have access to the polls. So that's something that in the coming weeks we'll be talking about. Last week, the council approved 15 sites for early voting. That's something that I'm very interested in. But I'm going to be taking a lot more very proactive and aggressive steps to make sure that we have safe and secure voting that will allow people to be part of our democracy. So stay tuned on that one. There's a lot more news to come on that.
Excellent. The next question is from Tom Durian with TMJ4, and it's for Commissioner Kowalik. He asks, for the businesses that are granted a permit for sidewalk dining, will their capacity increase? Will it be 25% of their normal capacity, or will it be expanded in some way to allow for more customers as the restaurants try to get back on their feet?
So since this is a pilot, we need to investigate that a little further. My understanding is we're still looking at what their occupancy is. So that would determine what they're allowed to do. If you think about years ago when the smoking law went into effect and how you had all of these businesses adding on these like 3 seasons or whatever patios to expand and have a smoking area, we see some of that happening now where we're seeing some creative strategies for adding capacity, but we're looking at what they're licensed for at this point in time, and that would have to be formally adjusted to add capacity. So more to come on that. Again, this is a pilot, so we're looking for ways to create opportunities, but also minimize the risk, because we know that being stagnant and sitting and, like Representative David Bowen, he was just having coffee with someone and he got exposed to COVID-19. So we know that something as innocent and short as that can put you at risk. So whether it's indoor or outdoor, just being stagnant like that is a concern.
Our next question is for our health representatives as well, from Graham Kilmer, and it is, the WHO released a statement on asymptomatic spread that led to widespread news reports indicating that this type of transmission is rare or unlikely. Today you noted that asymptomatic spread is a concern. Can you comment on the news caused by the WHO statement and explain why asymptomatic spread is still a threat?
Sure. So I can start with that. The World Health Organization, during a press conference like this, received a question about asymptomatic spread and said that contact tracing studies, a limited number of contact tracing studies, have not shown many cases of asymptomatic spread. That led to a lot of news articles and a lot of assumptions. They backstepped that the next day and said 2 things. They said, number one, that it's based on very limited studies of contact tracing and that it's unclear. And number 2, they said that really we need to differentiate out pre-symptomatic from asymptomatic. So pre-symptomatic is that time period before somebody gets symptoms. So they're infected with the virus. They have enough virus in them that they can potentially be contagious, but they don't have enough virus that it's yet given them symptoms. And so studies suggest that those people are quite contagious. However, asymptomatic people are those that may never become symptomatic. These are most commonly children or young, otherwise healthy people. While there haven't been too many studies that have found very clear evidence that they're transmitting disease, when you look at viral counts and viruses transmitted, the suggestion is that they still are. So the World Health Organization has stepped back those comments, said that it was a bit of a misspeak during a question in a press conference. But nonetheless, it's very difficult to know whether you're contagious, because if you have COVID-19, in that time before you get symptoms, when you're feeling just fine, like presumably all of us on the call are right now, you very well could have the virus. You very well could be transmitting it. Thanks for the question.
Thank you for that context and clarity. Our next question is from Nick Williams with the Milwaukee Business Journal, and it's for Commissioner Kowalik and Mayor Barrett. He asks, do you anticipate altering some of the guidelines in phase 4 before the city moves into that phase, presumably this Friday?
So, yeah, so our concern again is once we move into a phase, we wait one incubation period before considering that we would move into another phase. If there's any red during that time period, then that means we can't move into phase 4. So unfortunately, early last week, we had red for testing, and that obviously is a concern. And we know that testing's been down. I mean, the mayor has noted it, Dr. Weston, County Exec Crowley, like testing's been down, and we're assuming it's for a variety of reasons. One, because of perception of risk, right? 2, related to the demonstrations and protests. If people are busy, protesting and whatnot, their time is shifted. They're not gonna go and wait in line to get tested. And then thirdly, just again, some concerns about maybe there's a perception of who's helping to staff the community testing sites, if it's a National Guard, and then when a National Guard was brought in to provide support for the police department, that was seen as a negative action. So why would you go to the, you know what I mean? So there's some interplay here as far as why there may be reduction in utilization of those community testing sites. But it's my understanding that testing has been down in the area in general. So we just want to continue to promote that there needs to be testing, and it's not like getting tested once. Testing should be ongoing depending on your level of risk. If you're an essential employee, definitely being tested. If you have symptoms, even if it's like a scratchy throat, that's sore throat, go get tested. We know those community testing sites also test asymptomatic people. So that's an important outlet. We know many of the other healthcare provider outlets for testing require at least one symptom. And that symptom list is expanded now. So again, it covers many things that you may have day to day, like body aches, like myself. So we just wanted to remind the public, please get tested, because that testing, we look at the number of tests as a way to look at how are we doing with our COVID response, but we also look at the positivity rate. And if the positivity rate is where it needs to be, that also helps us too to know how prevalent COVID is in our community. But if we're not going through the test the way that we should be, it's going to suppress our ability to really understand how COVID is moving through our community. So please get tested. It's a very minor discomfort, the nasal swab, definitely not like a blood draw if you do the antibody test, which is more involved, but we definitely need more of our community to get tested on a regular basis. So we'll be evaluating phase 4 next Friday. So we'll provide an update if we'll move into phase 4 on the 26th of June because of that.
And the last question in the queue is actually a follow-up question from Nick Williams. And Commissioner, you did just touch on this. I don't know if you have anything to add, or Dr. Weston, but can you give an update on the gating criteria and those indicators?
Sure. So we have our website, Moving Milwaukee Forward Safely, or milwaukee.gov/MMFS, or .gov/MMFS, and it lists all of the orders. It has the table with the gating criteria. It's available in Spanish and Hmong as well. But the detailed information for the criteria, let's see, normally when we do these Friday media alerts, is we just touch again on what phase 3 entails. And the big difference with that was the allowance of dining at 25%, or bars being at 25%. Retail establishments went up to 50%. That whole, the lesser of the 3 for gathering of 250, 25% of the occupancy, or 1 for every 30 square feet distance between people is another one. We're still looking at 1-to-1 for salons and spas. You know, we know that that's been a source of some outbreak in other areas of salons and spas. We also know that there's still questions about contact sports, and contact sports, the only allowance is if there's an approved plan for professional sports, to make sure there's risk mitigation included there. And I'm just going through because it covers all sectors. Hotels, again, that they have been allowed to now open their gyms and pools. The capacity, maximum capacity for hotels and motels in general now is 50%. That was 25%. And then the gyms and pools, the maximum capacity is 25%. Faith-based is the same, the lesser of the three, the 250, 25% of total occupancy for 30 square feet. Childcare, 50% of building occupancy. Libraries, up to 25% of capacity. And I believe that's it. Again, if you just go to that website of Milwaukee.gov/MMFS, you can see the orders in the table, which again is translated in those languages, and that we would be providing updated information as we move into phase 4.
Excellent. Well, thank you for providing those details. And we do not have any other questions in the queue. So thank you all for joining us today, and we'll see you on Thursday.
Thank you very much.
Thanks.
Thanks.
Take care.
Bye.